All the anemia groups have one common goal: to educate and instill confidence in women who are pregnant or are planning to be pregnant. Specifically, the health literacy group will focus on exactly what anemia is, as well as the risk factors, symptoms, and complications it entails.
The importance of anemia prevention ranges from helping both pregnant mothers and their children make sure that they get the proper nutritional needs for them to not experience any sorts of discomforts that might be associated with anemia. Moreover, we'll also be covering the social factors that might lead any sort of family to become anemic or any individual. We'll also be covering the current strategies that are already in place by various organizations in Nigeria, and we'll also be talking about the current prevention practices that we may recommend for any individual to prevent this disease.
And as the treatment group, we're going to be introducing you guys to the different treatments that we're going to provide, and then some misconceptions that are often found within the community, and then also some practice diagnosis.
First, the health literacy group will discuss its findings on anemia. But first, meet the team. I'm Erica.
I'm Galen.
I'm Katie.
I'm Bricky.
I'm Catherine Brady.
And I'm Jackie Sullivan.
Our workshops are designed to educate women on the characteristics of anemia. The activities, which will be discussed in more detail later, will require 30 minutes of allotted time and paper so each participant can have their own copy of the handout.
So what is anemia? Anemia is caused by the lack of healthy red blood cells in the body due to inadequate hemoglobin production. Due to the lack of hemoglobin production, which carries oxygen, anemia causes the body to have a lack of oxygen in its cells. This can cause a number of issues, ranging from mild to severe. Mild issues may be dizziness or fatigue, while more severe issues could be heart issues or possibly death. Anemia is not contagious, but there are certain groups that are more prevalent to it, such as pregnant women, young children, females, and teenagers.
Although anyone can contract anemia, someone's gender, age, and social condition can significantly impact their chances of developing anemia. Females, specifically pregnant women, the elderly, teenagers, children, infants, immigrants, aborigines, and those in poverty have a much higher risk of developing anemia. Even people who fall outside of these categories can be at a very high risk if they have things like low iron, low vitamin C, drink excess alcohol, have GIT, autoimmune diseases, or even depression. Diet is the body's main source of iron. So iron from food, when consumed, is absorbed by the stomach, and then with the help of vitamin C, is then distributed to the cells of the body. So although iron deficiency is the overarching cause of anemia, if someone has low vitamin C or has another condition that impedes the body's ability to absorb iron, someone's at a very high risk of anemia.
Our group created a visual to demonstrate iron deficiency in a less complicated way. As you can see, anemia's root cause is a poor diet. While the iron-rich foods lead to a healthy amount of blood cells, foods lacking sufficient iron deplete the body of the resources needed to create new blood cells. As a result, anemia develops.
Due to these complications with severe anemia, there are a lot of complications that can lead to death, heart problems, nervous system issues, extreme fatigue that can all lead to death. These risks will also affect women who are pregnant. Vitamin B12, which is a deficiency, vitamin C deficiency, and folate deficiency, which are complications that lead to loss of blood for the baby, postpartum depression for the woman. The woman can also pass her anemia down to the baby, which can also lead to neural problems for the baby.
Why is anemia so prevalent in Nigeria? Malnutrition. The reality is that people in Nigeria don't often have the necessary funds needed in order to purchase iron-rich foods, which leads to them having a poor diet. As you can see on the screen, here we have some common foods in Nigeria that are very high in iron, but the reality is that the top 3 are meat, egg yolks, and leafy greens. And on the left, right here, we have foods that are low in iron. So chicken, dairy foods, and tea.
Cultural considerations. We as an entire anemia group understand that there are many different beliefs and traditions in Nigeria. So coming up with our food recommendations and activities, we have consulted a Nigerian doctor, Nigerian citizen. For our foods that we recommend, we have chosen foods that are simple and inexpensive, such as spinach and groundnuts, to ensure that most citizens will have access to them and be able to get their iron-rich foods. In regards to our activities, they include many pictures and understandable designs in order to hopefully help overcome the possible language barrier that may separate us.
So as previously mentioned, it is very important to us to create activities that will actually be beneficial for the community, and this includes the foods that we're going to see on the next slide that are common in Nigeria and are iron-rich. So we have created this game, and basically the point of the game is you go through the different rows. There's one on each row that is iron-rich, and your job is to figure out which ones are iron-rich and which one are a little lower in iron or even iron moderate. So go ahead and take a minute and see if you can figure this out. Were you surprised? The ones with stars are iron-rich, and the other ones are considered to be not as high in iron. So if you have anemia, it would be really important to get any of the ones that have stars on them.
For our next activity, the participants are going to play charades. So the common symptoms of anemia are going to be written on slips of paper. One participant is going to pick a slip and then act out the symptom that's written on their card, while the rest of the attendees try to guess the symptom they're acting out. In this way, we are utilizing fun physical activity to help our participants remember the symptoms of anemia so they can watch for them in themselves and the people they care about.
For our third and final activity, we decided to do acronym making. Acronym making is a fun and effective way to help people remember certain things. As you can see, we have come up with our own acronym right here, just as an example of what the participants will do. They will split into groups, and each group will come up with their own fun acronym to help them individually understand what anemia is. While it does not have to be anemia related, it must help them remember what anemia is. Up next, please welcome the prevention group of anemia.
I'm Eva Kristoff.
I'm Akarsh Menon.
I'm Anandita Desai. I'm Jacqueline Hastings.
And I'm Nia Lu.
As an academic journal said, pregnant women, depending on their level of education, have a considerable variation in knowledge and practice on the prevention of anemia in many developing countries. For this reason, it is important to educate people on ways to prevent anemia so individuals are able to take precautionary measures and feel confident in sharing their knowledge with others.
Some current strategies in Bauchi. The Nigerian government organized maternal and child health care week that does community-based delivery of vaccines, essential medicines, and nutritional education. Next, Madosath is a Nigerian non-governmental organization that conducts campaign days and provides household treatment for tropical diseases, and along with nutritional education and vitamin A supplementation. The Nigerian Federal Ministry of Health collaborates with the individual state ministries in order to provide nutritional counseling and iron folic acid supplements to pregnant women.
With 40% of Nigerians living on $1 per day, many people have trouble finding food and let alone finding a balanced, nutritious diet. This situation is exacerbated by the fact that many Nigerians don't have access to information and resources on anemia that they can use to help them choose more nutritious options. For our workshops, we hope to provide our participants with practical information on anemia that they can use in their daily lives.
All right, so here's our lesson plan for anemia prevention. So for our main objective, we want our participants to fully understand and know the foods that are high in the nutrients necessary for anemia prevention. Then, in turn, we want them to spread the knowledge that they accumulate throughout our workshop to others in their community. We also want them to know any precautions when they notice anemia, signs of anemia in themselves or others within their communities. And then for our workshop materials, it's pretty simple stuff. We need paper, ink, tape, as well as a poster. So we have planned 3 activities, each spanning 10 minutes, which my teammates will now discuss in detail.
For our first activity, each corner of the room will be signed yes, no, maybe, or not sure. The facilitator will read out a statement, and each participant will walk to the corner of the room that correlates with their opinion. Then they will have a short discussion about what they would do and what they think. The goal of this workshop is to allow the participants to apply their knowledge of anemia into real-life situations.
For activity 2, we have an interactive poster. If you look at the top image, we have 3 columns: iron, vitamin B12, and folic acid. What the participants will be seeing is the first image, with the answers covered with numbers on it. To figure out the answer, the participants pick a number, and the moderator will read out a hint. Then the participants will try and guess the hint in the answer, and that will be the food revealed under the columns.
Our third activity is called What Would You Do? And it should take 10 minutes to complete. For this activity, participants will be split into 3 even groups and will be given the same 3 questions to answer for each scenario. When they come up with their answer, they can share amongst their group, and in the final minute, we will all come back together and share our favorite answers that people had said. We will now hear from the treatment group.
I'm Logan Bowerman.
My name is Nick Adams.
I'm Zach Emil.
I'm Noah Idaho.
I'm Andrew Patel.
And I'm Alexander Glass.
First, I need to talk about the different types of treatments for anemia. There is a new IV drug that has just been approved by the FDA. Then we have parenteral iron supplements as well as iron pills that you can be taking. On top of that, you can take some vitamin C, which will allow your body to better absorb the iron that you will be taking. And for more severe cases, they offer blood transfusion. But the most common form of treatment in Nigeria is changing your diet to have more iron-rich foods such as leafy root vegetables and red meats such as steak. So misconceptions regarding the treatment. Education. Not many people in the area have enough education on the types of treatments, especially since there is a new drug out there that is supposed to be the most efficient drug compared to all of the other ones offered. Next, the affordability and the cost for the drugs is not exactly cheap. Most people, like previously mentioned, are making only about $1 a day, and a blood transfusion, as we all know, is going to cost a lot more than that. So having something such as a new drug or even a blood transfusion just isn't an option, which is why they are resorting to only changing their diets.
So for our workshop, our participants will have the opportunity to learn about different types of treatments for nutritional anemia, and then realize the treatments available to them without you. And then by the end of our session, participants will now have the skills to identify and know what the different types of for treatments for nutritional anemia do for them, as well as communicate why it's so difficult for the people of Bauchi to receive treatment and have the ability to spread their new knowledge of nutritional anemia.
This will take about 30 minutes, and the materials we need were handouts, flyers, and we have a guest speaker. Just give us the chance to explain many different treatments for anemia and explain the common ones around the area.
So the objective for our first activity, we want to provide our audience with the opportunity to learn and gather info on how they can get treatment as a pregnant woman. And this could affect them positively because it can affect the fetus along with the woman. And yeah,
and we will give the audience a chance to fill this out. And then afterwards, they can show what they learned and any additional feedback that they have.
For all of our funding, all of the anemia groups had a total of $1,500 to spend. After allocating $500 to refreshments and advertisements, we had $1,000 to split amongst the groups within anemia. Health literacy used a total of $220 to pay for take-home materials and colored paper.
For the treatment, all we need is the flyers, and that will be a total of $100.
All right, and then for prevention, we just need our take-home materials as well as the poster, which brings us down to a total of $150. Now, since all three groups were so carefully strategic about planning out our budget, we were able to allocate $530 to sponsor not 5, not 10, but a total of 17 individuals for a primary care checkup appointment. I want to point out that this could cover over 50% of our participants. This sponsorship would be aimed towards helping pregnant women who may have noticed symptoms of anemia in themselves or others, or pregnant women who may be concerned about developing anemia and would like to speak to a healthcare professional in order to fully understand how they can best take care of themselves. Next. All right, so let's reflect on our entire proposal. So all three groups have demonstrated that interactive education that is focused on diet and lifestyle choices is crucial for preventing anemia. Also, sponsorships like the one that we have proposed can have profound impacts on those that we give them to, especially for people who may not have otherwise had access to this. All right, for ethical considerations, we always made sure to consistently respect Nigerian culture and culturally centered our workshops around them, such as making sure that we focused on foods that were familiar and accessible to them. Lastly, we also made sure that our sponsorship system was fair and proposed a first-come, first-served basis. Lastly, our role is to support pregnant women at high risk for such a devastating disease by providing them with the information that they need to prevent anemia. It's life-saving education, and we encourage them to share that knowledge with others in their community to optimize our impact. Lastly, we are fully committed to the strengthening of individual confidence in the Bauchi community by providing them with knowledge that serves as a powerful tool to protect not only themselves, but their loved ones and their communities from developing anemia. Can you please go to practice? Of course, we want to give a huge shout out to all the interns who worked on this presentation. So for prevention, health literacy, and treatment, they put in a lot of effort throughout this entire week. And we also want to give a huge special thanks out to LI staff and our mentors who guided us and supported us throughout this initiative, especially Dr. Aisha and Umar, who are always there to answer all of our countless questions. We are very grateful for this opportunity. Thank you so much.
We're going to start with Dr. Aisha. Feedback.
Okay. Thank you, the Anemia team, for this wonderful presentation. First of all, I would like to apologize for keeping you waiting on the stage. Sorry, it was unintentional. I got lost, and with the rain, I was a bit delayed. Okay? So the presentation was wonderful. The literacy team was amazing, okay? Because treatment, prevention, literacy, all has to do with health education. And they made that very clear that, having good knowledge about anemia and the signs and symptoms is really important. So I like how you all brought out the information regarding, awareness about anemia. Okay, so well done, guys. The social determinants for the prevention team was well highlighted. I love how the presentation was. Everything was clear and straight to the point, and the font size was good. Okay, you guys highlighted the social determinants. It also included health education, so which is a really good one, because, and the part where you guys highlighted those at risk, okay, the women, the children, okay, the pregnant women. That was really good, okay? And for the treatment of anemia, you guys did well, except for the fact that you didn't highlight different grades of anemia because we have different treatment. You all focused on prevention, okay? When the aim is treatment, okay? So, and we know there are different treatments of different grades of anemia. And yeah, one of you mentioned blood transfusion, and nutrition, but nutrition is just for mild cases of anemia. And if we would like to prevent death and morbidity or in children or pregnant women, nutrition isn't enough to actually prevent that, okay? Otherwise, you all did perfectly well. I just wanted to add that distinction is really important. You guys should have emphasized on it because it's really important. All in all, you all did great. You know, it's hard to believe that it's the same students I met a week ago, and how really prepared you all looked and how wonderful you all performed. So well done and congratulations. Thank you.
All right, Umar.
Well, thank you guys for the wonderful presentation. First and first, I'm really impressed about the teamwork. Yeah. You all are different groups, but the simulation is so wonderful. The accent from one group to another in terms of your presentation is absolutely amazing. I'm really thrilled by that. I know we've been working together, and you guys pulled all this in 1 week. It's really incredible. And the game, it's so simple. It's actually direct, considering that, you know, there are cultural differences, but you simplify it, you make it very easy for the participant to actually understand the message you're trying to pass to them. And using like the images, it's so much easier, and it makes it more realistic for them to learn. And another thing is that I would like to also talk about how you justify your budget. You know, what you, like, this is how much you plan to spend on this activity, and then you realize that you have a leftover money. For some people, they were just kind of like, okay, so we have leftover, what do we do with it? But coming up with the idea that still you wanted to help out in addressing the issue of anemia in that society, it's actually a great thinking, and I can't thank you enough for that. And your slides are very, very entertaining, because I keep looking forward to one slide after another, because the simulation is so clear. Just like Dr. Aisha said, it was really clear and understandable. For anybody who is following up will understand what is really going on. I'm really proud of all of you guys, and you should go back home proud of yourself, because you made changes today. So thank you very much.
Yeah, I would agree completely with Dr. Aisha and Umar. It was a very straightforward, very clear presentation, which it's not easy to do with just a small group and with a very simple topic, but anemia is complex. You all collaborated together and made a very cohesive and clear presentation. So right off the bat, that was awesome. The overview of anemia was especially direct, which I really liked. The one thing in the beginning I would have liked to see a little bit more of is just contextualizing the scope of the issue in Nigeria, but it was there. I would have just liked a little more discussion on it. The overview of risk and who's at risk was phenomenal. It was absolutely incredible how detailed it was and how focused it was on the social determinants of health. For the actual prevention portion, I loved the first activity where they were interacting by moving around the room and just kind of acting, this activity almost acted as a pre-survey to get people's attitudes and their level of knowledge before any of the other activities. And then it had a discussion component, which I really appreciated. And then in the treatment, that formal pre and post test is going to be so critical to evaluate the effectiveness of the workshop. So I'm really, really glad you all included it in there. And overall, I think one of the things that stuck out to me the most was the line about strengthening the confidence of the individuals, because that is really what this is all about. Strengthening their confidence in themselves, in the healthcare officials in their community, and in the broader medical system that is available to them in order to actually treat their disease. That is what we want people to do. We want them to be confident in the healthcare that is there, in the doctors, in the community leaders that want to provide everybody these resources and knowledge. So overall, I think this workshop did an outstanding job of meeting that criteria and exceeding it, and you should all, like Umar said, be incredibly proud. So congrats, everybody.